But that's also an update on the situation, the COVID situation in the Ashanti region by health authorities. They will bring you that report by Home Interior in our later bulletins. But Programs Director of AngloGold Ashanti Malaria Control Ltd, Agamal, Samuel Asiedu, has hinted of the setting up of a test center for COVID-19 and other diseases in the region. He's noted that when the testing center is set up, it will reduce, among other things, the transportation challenges faced by frontline health workers in the region when they are sending samples of the test taken there. Rafiq Salam reports.
One key challenge faced by frontline health workers in the Upper West region in the fight against the COVID-19 pandemic is the lack of a dedicated testing center for the region. Health authorities have on numerous occasions lamented about the teething challenges they encountered about sending out samples from the region to either Tamale or Kumasi for testing. However, all may be a thing of the past, as AngloGold Ashanti Malaria Control Program Limited, Agamal, is now in close contact with the Upper West Regional Health Directorate for a possible setting up of a testing center in the region. Program Director of Agamal, Samuel Asiedu, disclosed this when Agamal donated personal protective equipment to the Upper West Regional Health Directorate as part of the company's $300,000 support package to the region to help in the fight against the COVID-19 pandemic.
And we would like to help facilitate the possibility of having a testing site in Upper West region, so that instead of picking samples and taking it to Tamale, we would then have our own site for testing. And this may go beyond COVID-19 as test system that can take care of testing TB and other infectious diseases, so that Upper West Regional Hospital should be able to have that capacity to test. And again, as part of the response to COVID-19, it's not just testing and providing isolation center, but education is very essential. We are going to embark on massive education that the people in Upper West region will come to understand and appreciate what it takes to prevent.
Throwing more light on the $300,000 support package to the region, Samuel Asiedu revealed that the package will see to the daily disinfection of 13 major health facilities in all 11 municipal and districts in the region.
So as part of our program, every evening we are going into the facilities to disinfect. This is not just a one-off program, but we are doing it based on science and based on data. So that will be done every evening. In addition to that, high-touched areas, including door handles and places that people sit, we are going to disinfect these places periodically, so that in case virus land at any of these places, with the kind of disinfectants that we are using, this virus will be killed and the people in Upper West will be protected from COVID-19.
Acting Upper West Regional Director of Health Services, Dr. Damien Poyere, who received the items on behalf of the Directorate, thanked Agamal for the kind gesture, stating that the donation was timely, as it will go a long way to easing some challenges they are grappling with. Dr. Damien Poyere also gave an overview of the COVID-19 situation in the Upper West region.
Region has now recorded 22 cases with no death. As at yesterday, 12 of these cases have fully recovered and reintegrated into their communities. We're expecting more results. Most of them on admission have had the first negative test, and we are waiting for the second negative test to determine whether they are cured or not. So going forward, I'm sure within the next 2 days, many more of these cases will fully recover and be integrated back into society.
Reporting for J News, Rafiq Salam. Wow.
Well, that'll be it for the news, but we have more updates of news as we also get interactive with the front, center spread, and back pages of the newspapers. Myself and Gifty and Doapia, of course.